Hi, everybody. I'm Randy Aki. I'll introduce myself again. Thank you for being here. Thanks for the wonderful panelists that we had just a little while ago, I think, and our speaker, Bill, earlier. I think sort of they set the stage for what we intend to talk about a little bit more at length right now. Some of the research looking at the benefits of disaggregated data and its impact on social determinants of health and health policy outcomes. I just want to sort of, again, welcome you guys again to Brookings and reaffirm our institution's commitment to independent research, as well as acknowledge the funding that we received for this event and also for the research that Amelia and I have conducted here from the Robert Wood Johnson Foundation, which made everything possible today. So this work is joint work with two other co-authors, Maggie Jones and Sonia Porter, who are both at the US Census Bureau. And I'll just read the disclaimer that this presentation is intended to inform interested parties and encourage discussion. The views are not necessarily those of the US Census Bureau. All of the work that we've done here has gone through and been cleared by the Census Bureau's Disclosure Review Board, and we've done the appropriate rounding so that no confidential information is disclosed. And the topic today that I'll be showing you sort of really gets at the heart of what we're talking about today, and it's about Asian and Hispanic earnings inequality in administrative data. And we'll show you, hopefully convince you of some of the benefits of disaggregating data, especially amongst race and ethnic groups, where otherwise you'd have this sort of collapsed aggregate version. The idea is that we'll be able to show you more of the nuances, and John Yang spoke about some of this with regard to the Asian American population. Anna did a bit to some extent with regard to the Hispanic population. And what we'll show you is some stuff that hasn't been possible before, and I'll explain why it hasn't been possible before. But again, we know that particularly we're going to look at inequality, we're going to look at earnings inequality. And we know that inequality has been increasing over the past 30 years, and it's been changing across demographic groups. But data, hard data for small racial and ethnic groups are often obscured because national surveys don't have enough observations for these groups to report out. And so the analysis that we do have typically tends to be for the United States as a whole. Some of the most famous work on income inequality in the United States or even in Europe abstracts away from race and ethnicity because they're using administrative data from the Internal Revenue Service or Treasury data, where there is no race and ethnicity. And using other sources of data, there are just not enough observations there. And so what we're going to do in this is we're taking annual data from the W-2s and 1099s, which is IRS data for Asians and Hispanics, and then we're going to link their IRS data to census data. That allows us to get the race and ethnic background. And we're going to look at two groups in particular, Asian and Hispanics, because of the fact that there's such wide-ranging differences. There are other groups as well, as we note, but for the purposes of this paper, we're only looking at those two groups. And these also are interesting groups because they tend to be the largest flow of immigrants, of sort of new populations to the US as well. So they're also interesting in that respect. And then, part of the problem, as others have mentioned, is that averaging over these populations may lead to suboptimal policies because you're obscuring what's really going on in these subgroups. And so the data that we use, as I've mentioned, will restrict our analysis to individuals who are 18 to 45, so a young component of the distribution of these populations, from the American Community Survey. And the American Community Survey is the annual survey that's conducted by the US Census Bureau to get the characteristics of the population. And we take that information and we link it to the Internal Revenue Service W-2 and 1099 forms. And we follow these people up until the year 2015. So we've got about 11 years. But the panel of data starts in the year 2005. This allows people to leave the panel data, essentially die or retire or migrate abroad, but we don't add new people in. So we're really looking at a consistent group of people across time. We find about 93% of Asians from the ACS data in our administrative data, and then we find approximately 92 Hispanics. So we don't lose a lot to attrition, or we don't lose a lot to the mismatch of individual identifiers. And then when we match in the subsequent stage, we get about 81% of those observations, which is actually, approximately sort of labor force participation. It's actually a bit higher than the average in the US, actually. And there's a selection going on. The people that we end up identifying tend to be sort of positively selected with regard to earnings and educational attainment. We go into more detail in that in the paper, but let's just jump to some results. Here's a earnings distribution for Asians in the year 2005. What we show here is sort of disaggregation of the Asian group. We have the big groups: Asian Indians, Chinese, Japanese, Korean, Filipino, Vietnamese. We have other, which are all other Asian categories combined. We have a total Asian category, and we have a non-Hispanic white category as a comparison. So it's a little tough to see on this figure because there are so many lines. What I'll draw your attention to is the fact that the Asian Indian line is sort of lower, flatter, and more skewed to the right, which means sort of the mean and median for this population is higher than that for the other groups, which is something you would see in, again, an average income or per capita income earnings measure. This just shows you the distribution and that the tails are fatter for this group as you move towards the right. The other, I think, interesting result is that the other group, this sort of light blue category is peaked is sort of most skewed at the lowest levels of income. So again, getting to some of the results that John Yang spoke about, sort of these other smaller Asian groups may have some of the most adverse economic conditions. This slide does the same thing for Hispanics. And here, again, we have a disaggregation by Cuban, Spanish, Mexican, Puerto Rican, Central American, Latin American, and other Hispanics, and then again, non-Hispanic white. What I'll draw your attention to again is that there's a clear outlier in terms of sort of higher income subgroups, and in this case, it's the Cubans. It's that sort of lower line with the fatter right-hand side tail. So again, just immediately from looking at just something like this, we see that there are stark differences within these race and ethnic categories. And again, we'll have a working paper out that you can investigate these a little bit more closely in the future. One thing I want to show you are Gini coefficients, which are measures of income or earnings or any other type of inequality. And the way to conceptualize this, so I won't go into the math about it, but that an estimate that's closer to the number 1 indicates more inequality. So all resources, whatever they might be, income or earnings, belong to a single individual, right, in that society, in that group. An estimate that's closer to 0, on the other hand, indicates absolute equality, so that all resources are evenly distributed or divided amongst individuals in that group or community, right? And in reality, we'll see something between that. And so just have that in your mind that Gini coefficients closer to 1 mean more inequality, and closer to 0 mean less inequality. And what we end up doing is we end up computing these year by year, group by group. And this hasn't been possible before because we didn't have this micro data at these detailed race category levels at an annual basis for earnings for these populations. As I said previously, these types of earnings data existed, but they existed without the race and ethnic subgroupings available. You may have been able to get some of that from some data, but especially with these small subpopulations, they were hard to get. And we're only going to show you the 6 largest groups of each of these categories. So just for an example, this is Hispanics. So the dark line there are the total of all Hispanics. So this is our aggregated variable measure. And in 2005, you see that the Gini coefficient for this community is about 0.46 or 0.47. And it continues, sort of mostly horizontal. It dips a bit. By 2015, it's below 0.45, right? And this is the period of the Great Recession. So what this means is that over time, Hispanics on average have become less unequal, right? They become more equal. And this could be due to the fact that more people are poor, right? Sort of there's a natural bottom there, right? There's a natural cutoff. And that could be a result of the Great Recession. The other line is non-Hispanic white, which also you see taking downturns slightly in the year 2009, but mostly horizontal, right? And so this is sort of the example of what you could typically get from most data. What we are able to do is disaggregate that dark black line into its constituent parts. And again, I'll draw your attention to the differences. One important difference is with Cubans, you see that their levels of inequality actually went up over the Great Recession, something that would have been completely obscured otherwise in this data. And remember, it's the same people, right? This is a panel data set, so it's not as if it's driven by new labor market entrants or new immigrants even. This is the same people who existed in the year 2005 and continue onward. So these differences really are happening to the same group of people. The other part that I'll sort of draw your attention to is the bottom line. Central Americans and Mexicans, they tend to have, on average, lower levels of income of earnings inequality, below that of the average, as you'd expect. And the other interesting thing are that Latin Americans and Puerto Ricans, for the most part, at least up until 2011, have approximately similar inequality levels as that of non-Hispanic whites, something that probably wouldn't have been predicted in the absence of this type of data. So here's a similar aggregate slide for Asians. Again, the dark line represents the aggregated measure. This is total of all Asians. The white line with the blue box, the black line with the blue boxes indicates non-Hispanic whites in the U.S. over the same time period. Here, a stark difference is that on average, Asians tend to have higher levels of earnings inequality at all years, which is different than what we saw for the Hispanics relative to non-Hispanic whites. And it's mostly horizontal. And then when we disaggregate this by the different race groups, one really stark finding is the results for Filipinos in the US, that their levels of inequality went down pretty sizably between 2005 and 2006, but also sort of this huge level difference in their inequality levels from all other Asian groups. So they have much more equality within their group than all other any of the other large Asian groups. The other interesting group of note are Asian Indians, which is this dashed black line. You see their levels of inequality are actually going up over time, and again are highest or larger than that of non-Hispanic whites. Right, and so again, I'll just flip through those one more time because I think they're pretty neat to look at. And again, we'll have a working paper for everyone to look at the details, but this is Hispanics. That's what happens when you disaggregate. This is Asians, and this is what happens when you disaggregate that dark black line. One other thing we can do with the data that, again, is not possible when you're in the absence of panel data is that we can actually measure mobility measures, economic ranking of that person. And so what we're going to show you here is a mobility. So not geographic mobility, but just mobility within the earnings distribution. So for instance, if last year my income put me as the 1 millionth person in the entire United States for my race and ethnic group, and next year I'm still at the 1 millionth position, then my movement is zero, right? I haven't gone up, I haven't gone down. So my correlation or my rank there should be a 1, right? I'm exactly the same as I was last year. Anything less than this 1 indicates some movement. And so more sophisticated analysis would look at whether or not it's upward movement or downward movement. And for the purposes of today, we're just going to show you movement. So what you should expect is that a number closer to 1 means no change, right? So conventionally, we think of that as immobility, right? You're sort of stuck. There's a rigid level of earnings in your community, in your group. And a number closer to 0 means more churning, more movement in the earnings distribution for your group. And so here it is for Hispanics. And the reason, let me be clear, the reason why you need panel data to do this is because you need to watch the same person over time. You can't just do a repeated cross-section. And so that's what makes administrative data merged to or linked to other survey characteristic data imperative in doing this kind of work, in watching the movement of individuals and not group averages. One of the comments we had earlier about that these groups might be endogenously changing. Marcus mentioned this, Sella mentioned this, and the denominator may change over time. And that's exactly one of the problems that we come into when we look at existing data sets that we have, is that we see a repeated snapshot of populations, and they may or may not represent the exact same individuals. So doing analysis where you freeze the group and you follow them year after year is going to be imperative in doing this kind of work. And that's what this data allows us to do in particular. And here we're looking at Hispanics. And so what you see is that almost every group is highly rigid. The numbers on the left-hand side are close to 0.9, right? Very high, very close to 1. Non-Hispanic whites have more rigidity, less mobility in their earnings over time than Hispanics. So Hispanics have more churning. They're more likely to move from the 1 millionth position to something else next year, right? Year by year by year. And we see what an interesting component is that after 2009, we see a slight upward shift of more immobility for everyone. After the Great Recession, everyone became sort of, stuck at where they're at, right? Not a lot, but there's some. If we disaggregate this result, I don't see too much change. There's some slight differences. Cubans, again, are that blue line here. They tend to have, a trend, an upward trend and above average. But by and large, there seems to be, again, a movement, but none of it ever exceeds that of non-Hispanic whites in any of this analysis. And now the next slide will show the same type of results for Asians. On average, I think what you could take away from this is that between 2006 and 2008, there's been a convergence of the immobility of Asians to be fairly similar to that of non-Hispanic whites. And over the Great Recession, Asians, on average, aggregated, look very similar in their immobility and that upward trend as non-Hispanic whites. Right? And so again, that differs tremendously from the Hispanic group that we just looked at. And if we disaggregate it, we see a little bit more differences than in the previous slide. We see that Koreans actually have more levels, have more mobility in their earnings than all of the other groups. They're sort of on the lowest level. They're upward trending as others are, but they are by and large lower than almost all of the other groups. You see some of the highest levels of immobility are amongst Chinese and Chinese essentially. So again, let me end on my last slide. What we intended to do here was to show how the average may obscure what's going on at the ground level in these different diverse groups. We looked at two different types of measures. One is just the inequality, and that was the Gini coefficient. The other was immobility, which is the movement of an individual to change their earnings ranking in the entire group population year by year. And what we find is that some groups have above average inequality, as you'd expect, and others have below. But these differences you couldn't have predicted beforehand. It would be hard to sort of understand that without this type of data and without this sort of merge of data, because these patterns are obscured. And they're particularly obscured for the smallest of the groups, because the averages, and as we don't show, I didn't show it today, but we have in some of the tables, are that some of the biggest groups dominate and they pull the averages in certain directions. Mexicans are a bigger group, so we don't see the impacts of Cuban Americans or Latin Americans on the average outcomes. And so again, that may obscure different types of things going on and policy advocacy. And so, as a result, as I say this, it might be harder to discern these smaller groups, which may hinder policy actions for targeting. And with that, I'll stop and my discussant.
Thank you, Randy and Amelia, for introducing me to this great data set that actually makes me very jealous. that I don't have access to it. So given the shortness of time, I'm not going to spend a lot of time on sort of summaries and stuff like that. I did want to point out that I think, as discussed in the first panel and during Randy's talk just a second ago, I think these sorts of data are very important in terms of complicating and providing nuance to these issues. Often, if you cut on the news, you hear this simple story of, say, for example, Asian success, right? Oh, Asians have best education, highest incomes, and so on and so forth. But when you look at sort of the data that Amelia and Randy are bringing to bear here, there's actually quite a bit. I mean, I should have put the picture in here, but just look at the left tail of that distribution, that right skewed distribution that they showed, and look at the level differences of that hump. And that tells you the degree to which there's tremendous variation in the earnings amongst people that we would classify Asians in this society, and similar for Hispanics. To me, I think the next steps here are to kind of understanding better these sources of within subgroup inequality, right? So one of the things that was discussed in the panel was immigrant versus native, right? In this first generation versus second generation. Distinction seems to be quite important. Let's talk about education. And what I mean by that is going beyond sort of our usual distinctions of college educated, graduate education, and where were these people educated? I mean, are these American educated people amongst the immigrants or native born, or were these people who were bringing degrees from other countries, right? Because that's important, because that might play a part in these earning trajectories that they're actually going to estimate. What's the role of race within subgroup? So I used the example of Cubans, right? I saw that big Gini coefficient for Cubans, and the first thing I thought are, some Cubans, if you go to Miami, some Cubans are black and some Cubans are white, right? And how much does that distinction versus other groups, say from Central America, which tend to be more classically mestizo, as they say, how much does that play a difference? And also, let's think about social capital and networks that are already pre-established, right? So there's certain pathways. I think of Filipinos and nurses, right? And part of the reason why you might see differences in inequality within some group could be driven by the fact that there's certain occupations that people are shunning into, whereas in other groups, they may have more variation in the types of occupations available, and as a consequence, you get a wider spread in earnings. This question that they brought up later about the mobility, this income mobility, right? And, even though there was some variation, the thing that struck me was this trend, this upward trend towards one, right? To me, that's a dangerous sign, right? But it also conforms with what we know about the overall society, in the sense that, we know that intergenerational socioeconomic mobility is declining, but also within generation, socioeconomic mobility might be declining as well, and that might be driven by educational differences. That might be driven by just occupations, the types of jobs that are available, and also wage stagnation in certain segments of the population. And I think that they have the ideal data. I think this makes a strong argument for why we need data disaggregation, especially when we connect it with socioeconomic characteristics, to be able to look at this at a much more careful way than some of the past studies of this. And also, what would be interesting is to think about, I know they don't have wealth, but to look at indicators of wealth at baseline and how much those factors might actually play in governing some of these trajectories that we might see. If we see, some of these groups, they start out at the beginning of the panel with houses or things of that nature. These things actually help sort of people smooth, especially when there's shocks. There's a major economic calamity in the middle of their data set. And how well does this allow certain subgroups having access to these things at baseline? How well does this help them smooth across that time period versus other groups that don't traditionally have access. I think about, when John Yang was talking about the Hmong and Laotian communities and the Vietnamese. I lived for a while when I was in high school in Fort Worth, Texas, and there's a large Vietnamese population out there. And the Vietnamese population essentially lived in the inner city, and they went to school with us, and they often suffered a lot of the same problems in their community as you would traditionally associate with the Black and poor Hispanic communities. And I think that's often missed. So anyway, I think this is a great start to a really nice research program. I think these data are fantastic. And I think this paper itself sort of makes a strong argument for why we need to take seriously the notion of data disaggregation. Thank you.
Answer any other questions. We got 5 minutes on the clock. So if there are other questions of individuals want to have, I'll just respond to Marcus. Thank you very much. These extensions are fantastic, and I think we have some purchase and possibility to do a couple of these things. And that idea about sort of the role of race within the ethnic category is brilliant. And I think that, especially with Cubans, I think you're exactly right that, And we get into the same situation that you mentioned earlier of this sort of how people self-identify specifically in these groups in this kind of, but it would be fascinating just to see what that is. And I think we might have enough observations to slice the data that way. Yeah. So any other, yes, Phil. Please identify yourself too.
Yeah, this is Phil Fan from Johns Hopkins. So in your data, do you have geographic location, meaning, so for example, you can look at movement between zip codes, right? And sort of a partial answer to Marcus's interesting idea about wealth, because we know that there's a high correlation between zip codes and wealth.
Yeah, so the answer is yes, we do. And we haven't done anything with that. I mean, we could also move people, whether people geographically move, sort of the fleeing of the Rust Belt or something like that. We haven't done any of that yet. But yeah, that's a possibility.
Inez Ponce from UCLA. Really fascinating. I hope you could do something like this with a data set in California called CHIS. So on the Gini coefficient, the Filipino was striking to me. I think it was the Gini coefficient where Filipinos were becoming less unequal. And you mentioned, but you don't know if it's becoming less unequal, for good or for bad.
Yes,
right.
That's
so
right.
Could you identify what the average, either maybe a 95% confidence interval, the range of earnings potential?
We have the earnings. We have the earnings.
Yeah.
And we can report on that. And we haven't in this. We haven't reported out annual earnings, actually, which just sort of incorporating
right,
it. But you're right.
That overlay would be interesting because, again, it's similar to health. We did a study in California where for diabetes, quality of care, there was very little inequality in the Central Valley region. For those of you in California, it's kind of the Farm Belt region. But the actual levels of quality of care was poorer than in the Bay Area, the San Francisco area, where there was huge inequalities, but everybody was kind of at a higher level. So I think that the level is also important when you're looking at some of these inequities.
Yeah, thank you. No, that's a great point. Yes, please.
Thanks. Hi, my name is Lynn. I was wondering, when you were looking at the mobility measures, had you considered taking into account differences in age distribution so that you may be catching some groups more at the beginning of their careers where you would be more likely to see movement, or maybe at the end of the careers where it would be going the other direction?
So we did restrict our analysis to 18 to 45-year-olds, so they are essentially all, relatively young workers. And we did that in particular because we didn't want to get anyone who was dropping out of our panel for retirement purposes. We've got about 11 years. So even the oldest people would have been about 54 years old, right? They were 45 was the last group. But I mean, your point is well taken that we did not allow for in other analysis that we have, we've also restricted analysis to people who are 25 years old and older, because that's sort of the post-college, those types of years. But for this analysis, it's relatively young workers. Yeah. Are we done?
And if I may add, I think you're asking about the average age within the disaggregated groups, right? So what we do have is in the means table somewhere, which we didn't show, the Asians are generally a bit older than the Hispanics, but within the groups, the profile is similar in terms of what's the average age. The Hispanics are, I think, about a couple of years younger, I believe, but within the Hispanic group, there is little variation in the average age within the
that's right.
subgroups.
Last question.
That was related to my question because the whites will be quite a bit older, right? If what we heard earlier is true, and you're using that as the comparison group. So I think that's when the age thing occurs. I was going to ask a similar question, which is if you're going to compare, say, rank mobility with non-Hispanic whites, then if those non-Hispanic whites start out 10 years older and there's a difference in rank mobility by age.
But it's a snapshot, right? That's frozen in 2005, and we just follow the same group. So that composition, whatever it is, it's
Right.
there at all points, right? The average.
So the gap, yeah. So it'll be consistent.
Should
It'll be
remain
consistently
consistent.
inconsistent. Yeah.
So thank you, everyone, for your comments. Happy to talk more about it during lunch. Next up is Sela Panapasa, who will talk about Pacific Islander and Native Hawaiian data. View slideshow?
No, how did, can you?
What version do you? Slideshow.
Good morning, and thank you to Andy, to Randy, and the Planning Committee for inviting me to this very exciting and important event. My presentation captures about at least 2 decades of work and effort, and will is a combination of a variety of tasks from my role as a researcher, but also as an advocate and a member of the community and population that this presentation is about. I would like to acknowledge my colleague, James McNally. We're both researchers at the University of Michigan Institute for Social Research. I was trained as a demographer, and one of my more recent interests has been around health disparities, health equity, and population health. So this work, disaggregating data to advance health equity, is an issue that applies to every group. It's not unique to Native Hawaiian and Pacific Islanders, but I'm hoping that the lessons learned, the barriers, the challenges that this population faces will resonate and to some extent offer useful implications and directions for other groups. So I'd like to begin with this pie chart of the distribution of the Native Hawaiian Pacific Islander population. And as you can see in the most recent census in 2010, the Census Bureau enumerated 1.2 million Native Hawaiian and Pacific Islanders. The population represents 0.4% of the total US population. So you can just imagine the challenges and the barriers associated with trying to understand a population that is less than 1% of the total population. I'm very excited. It's important to me. So here we go. As you can see, there are over 20 distinct population groups that make up the Native Hawaiian Pacific Islander population overall. What's so unique about this population, it's probably the only population, racial population, that is represented by an indigenous group, Native Hawaiians, migrants from the US territories and island countries such as Guam, American Samoa, Marshall Islands, Federated States of Micronesia. These are migrants who can travel, enter the U.S. without having to go through the formal process of immigration for naturalization, etc. And then we have a group of independent immigrants from Fiji, Tahiti, Tonga, to the U.S., and the fourth group is the naturalized U.S.-born citizens, children of the immigrants and migrants in the U.S. So it's important for me to share this with you because I would like you to think of the implication that has as a U.S. citizen, having full access to the to programs and services as part of the federal government system at state level, and then as migrants where they are may not be eligible for some of these federal entitlement programs, and then the immigrants where there's even more challenges for the group. What's great about the population is that we know from the 2010 census that Native Hawaiian and Pacific Islanders are present in every state. But as you can see, represented by the dark pink shade to the medium shade, they tend to concentrate along the western part of the country, including Hawaii and Alaska. This information is specific to all 50 states, and so is the rest of the presentation. I will not be reporting on demographic and disaggregated information for the territories and compact states. So here we are. Now, all of this would not have been possible without the OMB 15, which we are all very familiar with, where for the first time here we are able to obtain disaggregated information on the population. And as you can see, Native Hawaiian and other Pacific Islanders is a distinct racial population. And the mandate to federal agencies is to collect, tabulate, and report using these categories. These are minimum standards. So I'm hoping that as a result of this, the event today, that we would be able to go beyond these broad categories and begin to think of the many groups that fall within those categories. Now, this is another very important piece of evidence that was derived from the 2010 census, and that is among all different racial, ethnic populations, Native Hawaiian and Pacific Islanders had the highest rate of mixed race, multi-ethnic, multiple race population. More than half of the Native Hawaiian Pacific Islander population self-identified as mixed race. This is important for the next slides I would like to share with you. Now, this slide, I am introducing it because this is based on recent American Community Survey data produced, released by the Census Bureau. And the model minority myth, which was touched on earlier this morning, was real and may still be real for Native Hawaiian and Pacific Islanders. The OMB 15 was a direct response on the part of communities to advocate for better data, quality data on Native Hawaiian Pacific Islander populations, because the myth associated with being combined as an Asian Pacific Islander population was real for them. You know, you're familiar with the masking effects, and this slide actually shows the masking effects, the impact, and I think it's been touched on earlier by previous speakers, of the large, when you aggregate everyone, the estimate is driven by the very large populations like at the top. And so it makes us look better than we really are. And that's not a good thing. Because it distorts, it misrepresents the population, and as a result of these outcomes, you risk the possibility of being excluded from services and resources and opportunities as a disenfranchised, marginalized population group. But what's interesting about the slide is that we are seeing for the first time the growth of Native Hawaiian Pacific Islanders with the inclusion of a subpopulation, and that is Tongans. And that's the trend moving forward as the country becomes more diversified, that we can expect and begin to see more bars added to the very broad racial categories. But I would be remiss if I did not share with a phrase the population and communities had coined, in that for a very long time, we were a dot, a dash, or a star. And while the dot, dash, and star is getting smaller, as represented by the addition of Tongans, we believe more work, this still continues in statistical reporting by federal agencies. So moving ahead, with all of this known, one of the opportunities that was brought to us that we had was an opportunity to examine Native Hawaiian mortality using existing administrative data. The challenge, or one of the issues with this piece of work, is the definition of race in census data collection. So for the census 1990 and the definition for race in census 2000, as well as 2010, had changed. And so the challenge was, given this huge increase in the Native Hawaiian population between Census 2000 and Census 1990 and Census 2000, it was something that we needed to adjust for. And for the first time be able to report on Native Hawaiian mortality using these data. But it wasn't enough, because data was still limited on the population. And in 2012, we had an opportunity to conduct a health survey using a probability sample of Samoans and Tongans in California. And I do want to add a point to the day's discussion, and that is, our work would not be important without the without partnerships of community, local stakeholders, and trusted voices in the community for future data collection. And given that these are very diverse populations that we are working with, we need to ensure that those groups are present and are at the table. And so this was a model we had implemented. It was important for accessing Pacific Islanders. In California is an engagement of both community-based organizations and faith-based organizations, bringing them together and engaging them in the process of a community-based participatory research in both the planning, the design of our survey. And here's just one set of results that we were able to, that I'm sure we'll be able to share with you, and that is, we used the questionnaire was patterned after the National Health Interview Survey and the California Health Interview Survey. So we actually had comparable questions and data on our two populations. And these are these are estimates of the results from the survey and what we were able to learn from state level, county level, and national level results. And as you can see, the pattern for for Samoans and Tongans is represented by the light green and blue bars to your left, is that they tended toward, or their health tended toward good and fair, as opposed to excellent and very good. So that's very concerning. I would also like to, so the point with our survey is that we were able to demonstrate that you can conduct probability surveys, probability sample surveys of these small, hard-to-reach populations. You just need to understand and know who they are and know about the groups. So that was an accomplishment that we were able, and we were very successful with our survey. The response rate was 79%. And given that national surveys and most surveys are on a downward decline, I think there's much to be said with our approaches and a strong community engagement approach. This next slide is another example of how we are able to learn as a result of access to data, disaggregated data, but the data was derived from electronic health records. So something to think about, that is a very rich source of data for being able to disaggregate information on health outcomes. Now, what's useful about this and the lesson with this example is that we are still limited by the aggregation of data into these the broad category of Pacific Islander. And the issue around that is that, while the data is disaggregated, they do have information on Native Hawaiian, Samoans, and Tongans. It's so small that they're suppressing it. So data may be collected, but it's suppressed and reported in this aggregate form. But it does provide useful information on where the population is. This age-adjusted percentage distributions of stage at diagnosis for prostate cancer was derived from the SEER registry, the cancer that's supported by the National Cancer Institute, and a very useful and a potential source for gathering and reporting disaggregated information on specific cancer sites. And this is based on prostate, the stage of diagnoses for prostate among Pacific Islander men. Now, the last two slides, this is a result of advocacy work and an active community engagement. With the previous examples from our very small survey on the Pacific Islander Health Study, in 2014, the Department of Health and Human Services, National Center for Health Statistics conducted the first ever Native Hawaiian and Pacific Islander National Health Interview Survey. First ever, only one of its kind, and as you can see, data is reported for multiple race and single race, and compared to other racial populations based on their single race. And this is where I wanted to point out, within our NHPI population, there are real differences when you separate out race alone and race in combination. But when compared to other groups, currently, the national statistics, or HHS and federal statistics, reports data on the race alone. And that's a concern for Native Hawaiian Pacific Islanders because we could be underestimating the strength or magnitude of the problem, or we could be overestimating it because, as you can see, 14% of the single race children under 18 had or were diagnosed with asthma, as compared to 19% of Native Hawaiian or mixed race Native Hawaiian Pacific Islander children. And but then when we take a look at the results for adults that continue to be diagnosed with cancer, as you can begin to see the breakdown even within our NHPI population. So in closing, I wanted to draw attention to the need for health equity and the journey to health equity for this small, hard-to-survey population. Population health is a conceptual framework for thinking about populations and the need and whether they are healthier than others. And the population health model is very comprehensive. And the point is that while data is being collected on Native Hawaiian and Pacific Islanders, we still lag behind on all these major areas. And so the population health requires data on social determinants of health from multiple sectors. And while work has been done, we still have a lot to be done. And I would like to close with a quote: "Never doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it is the only thing that ever has." Thank you.
Good morning, everyone, and thanks for coming. I am the other organizer of this event together with Randy. My name is Emilia Simeonova. I am a professor at Johns Hopkins and a health economist in the organizing committee. So it's a pleasure to have everyone here and a very, very exciting discussion today. Until now, we're looking forward to an afternoon full of more interesting and thought-provoking presentations. I am going to discuss Sala's paper. I learned so much from just reading 20 pages. I'm a foreigner. I wasn't born here. I fall into many different categories that were discussed today. So I'm learning about the country and I'm learning about myself as well. And I would start with picking up where Sala left, the question of population health and what population health, why we need the data to talk about and produce policies that are relevant for population health. Well, population health is, the health of certain groups varies from health of other groups. And if we know more about how these differences arise and what they lead to, then we can create policies and steer policies, create incentives to address these issues before they become acute and chronic, address them at the point where they start. So if obesity is more prevalent in a population, we may start by treating and paying more attention to individuals with that background when they're still teenagers or children, and try to educate differently, try to have physicians pay attention to certain indicators earlier than in other populations. And that leads me to my next point, which is relevant for the discussion in the beginning as well. It is the importance of how you self-identify versus what your genetic makeup is. And that, I think, is important from the health perspective, because there are some things that are determined by how you self-identify, what your culture is, who you hang out with, versus other things that are determined more by what your genetic makeup is. So you may have the genes coming from a certain part of the world where you're more susceptible to diabetes, but you may be self-identifying and being part of a group that has different kind of, let's make it more pronounced, has on top of everything, has the eating habits, what kind of culture you have, how often you eat out and what you eat, that may either exacerbate the effect of those genes or it may counter them. So the genetic versus the epigenetic, I think the epigenetic is more determined by how you self-identify, and the genetic is just you can't do much about it. This is your genetic makeup. And so these are the kinds of things that I think are particularly important from a health perspective, because when you count people and how you count them, and from the perspective of population health, I think it's important to be aware of these issues as well. A very interesting part of what Sala's paper is talking about, and she raised it in the discussion, is about how we don't really have a way of standardizing how we collect the data. And she mentioned the numerator may come from one data source, the denominator is coming from another data source, and then you end up with numbers that don't really make sense. And so that together with the issue of we don't really have good data sources on these populations. There's been this celebrated 2014 oversampling of native Hawaiians and Pacific Islanders, which is still being analyzed, and also Sala's done some work, and Nina, who will be up a little later, have been doing a lot of work in these populations, trying to understand the issues that are coming up and disaggregating in the relevant categories. The important thing here, I think, is I'm an economist, so I have to bring this up, is who do we think should be doing this work and how this work should be funded? Because every time we talk about we need more of this, we understand that, but there's the budgeting, right? So who should pay for this? How should we do it? And I would like to bring this up just as a point of discussion. Maybe we want to make this private. So, the population itself should just get a private survey company that's going to do their study, and then they can use the study to report back to their legislators or whoever is interested in doing that. Or we can lobby the public data collectors like the census, the NHIS, and so on, to do more work in these communities. And I think it's important to make the case clear why we need more of this public work, because I think it will be easier to standardize, easier to gain the trust of organizers and communities if you have more of a public engagement rather than some private company going and collecting data. I'm agnostic to what would be better, but I tend to lean towards the public. And also I think it's important to emphasize how we cannot underestimate how important it is to have the engagement of the academic community, which first of all, has some advantage in knowing all the different data sources and how to collect the data, but also in bridging with the policy world, would have the appropriate ways of engaging the community, knowing how to engage the community from different disciplines in order to get representative data and to have people respond in the rates in which, amazingly, you manage to get them to respond. So these are the things I want to throw out there. I'm out of time, and I will open it for discussion. Thank you.
Thank you, Emilia. Those are very helpful remarks. I also would like to add, because it is mentioned in the paper, the reason why data collection and case sizes for our respective populations, certain subpopulations, are small. And that is because of the primary sampling units that the Census Bureau and major federal agencies are using to collect their data. The map, we know where the populations are distributed, we know where they're concentrated, and my philosophy is you go to where the people are. Relying on geographical or sampling frames that are heterogeneous, that's the problem. And we tested it with our Pacific Islander health study. We went to where the communities are. And we know that our racially diverse communities living enclaves, community enclaves, or tend to be clustered in certain areas. I mean, that's where you go to collect your data. And I think it was touched upon earlier this morning, but that has been my observation working with data, is looking when zeroing in on the sampling frames. Right there's the problem. They're collecting data from here, they're testing data from here, but our people are living here. And that needs to be addressed. That's the correction. But with that said, thank you. I appreciate it. Appreciate the time. And if there's any questions, I'll be happy to entertain them. Yes.
Hi, Neil Ruiz from Pew Research Center. First, I just want to say I commend you for the work because I know how difficult it is to survey, especially harder to reach groups. But I had a question about, impressive about the high response rate. What was the mode for conducting the survey? And two, I was just wondering if you could reveal how much was the cost? Because this is something that we, even at Pew Research Center, struggle when we try to disaggregate, trying to get to different origin groups. It gets really expensive as we get the harder to reach. And this is really the heart of what we're trying to do here in this conference, is try to figure out how do we cut those costs, or how can we actually do more of this great work. But I'm just wondering, just from your experience with this survey.
Thank you. Well, I'll answer the cost question. And the cost, if I told you the cost, you would, you'll probably be very surprised, but I have to admit the cost was very minimal. I was motivated by the need for good quality data on a hard-to-survey population. So I brought in a team of survey methodologists, extremely talented, skilled, experienced. I couldn't afford to pay them. The amount of money we received was pilot money, but the priority, the emphasis and goal was to produce quality data and to demonstrate that probability sampling methods can also apply to small, hard-to-survey population. The question on high response rate, I attribute that high response rate to a strong community engagement. As a Pacific Islander, entering the community, building this sense of trust, a trust relationship, understanding the cultural nuances associated with how you engage. And our message was very clear. The purpose for this survey is to produce quality data on the health of the community, and also to recognize that what is it for them? I'm not a helicopter researcher, which is something the community is very familiar with. There's a lot of research going on in their local communities, but very little return. And you need to have that hard conversation, which we did at the very beginning in building the trust and going in, they understood, and working with them on helping them understand the importance of the work and what the benefit or return. And the benefit and return is the National Health Interview Survey. I was part of the planning, implementation of the National Survey, where we collected data from over 3,000 households, and their response rate was 79%. Yes, Ninez.
Thank you so much, Celia. I know that this has been a passion of yours, and I think it was said earlier, the scientific benefits are you have better quality data. I think the heart of this meeting is not about cost, it's about value, right? So we say that in healthcare. And it's, I know from California, when we tried to oversample early on the Native Hawaiian Pacific Islander population, that it would be 3 to 4 times our average cost, just because it's a rare population, and that, but then the cluster sampling is one approach, looking into areas, as you said, like San Mateo, East Palo Alto area, the Carson, Southern California area. So I think it is a reality from I mean, I was a data advocate before I became a data producer. Like I'm now on the supply side. And so it's very, so cost is a big concern. And then Amelia's, question is who pays is really important. Is it government? Is it foundations? Thank you, Robert Wood Johnson, for holding this. But it's so our model in California is it's been likened to, I go around with a bake sale. It's like a bake sale model. It is a public-private initiative. It's a mix of government and foundations, as well as a major health plan who's very interested in the data, and local counties that want oversamples. And luckily, some of those oversamples include, like the San Francisco area, San Diego area, include a large proportion of Native Hawaiians that are Pacific Islanders. So I think the who pays part is interesting because from federal statistics point of view, it's I think they call it like reimbursables, the ones that are not appropriated by Congress, and the reimbursables are on demand. And so I think increasing the reimbursables are based on advocacy efforts, as you had noted, on that you want more data, and getting at congressional representatives that this is really important. So that part is important, and also from the federal statistics point of view, that reimbursables, the reason why reimbursables are scary is because because you can't, it's uncertain. So you don't know if these reimbursables are going to, continue, and with staffing. So I think something where the appropriations and reimbursables or advocacy and reimbursables have a longer timeline, not just a one-time only. So a 5-year, 10-year horizon for that would be really important in the federal statistics realm, so that the special NHIS, NHPI is not just a one-time only, but we saw the value of longitudinal data, or at least even repeated cross sections, are really important. So that's, I think, really imperative. And then we are doing an NHPI oversample right now. So and Sela's on, and Amelia, and we got all the we poached all the brightest folks here, and Randy. And what we're doing is we're building on Sela's approach of sampling different communities, but also doing respondent-driven design, where the seeds are going to we're going to recruit from halaus and from churches and social media, and then get more kind of network sampling, but then get rid of the first seeds. And so it becomes a little bit more representative as you get further down the line. It was hard for us because we were so probability-based in the California Health Interview Survey to think of non-probability, but for some populations, that's what you have to do.
Right. Can I just make, sorry, thank you, Ninez. Specifically, funding for our Pacific Islander health study was provided by the Asian Pacific Islander American Health Forum and Kellogg Foundation. Now, the NHPI, NHIS, we had proposed to NIH to conduct an NHPI, NHIS, and it was turned down repeatedly. Small population, anyway. But something that Ninez mentioned, our survey was administered in person. And the survey CHIS is planning on is telephone interviews. Am I correct? Oh.
We're changing mode. We're doing
you're changing mode?
Address-based sample, push to web.
Oh, okay.
With telephone
It's a web
as an
survey.
accommodation for
Right.
limited English proficient.
But the NHPI, NHIS, if you take a look at this, how the sample was designed, I think it's an excellent model and approach for other numerically small population. And I would be remiss if I didn't mention, since I was involved with the census as part of their AQE, if you recall, or it was the experimental questionnaire effort to revise how race is collected by the census, and that would help achieve more detailed, granular information on each of the racial categories. It was tabled under the current administration, but I'm hoping that in preparation for Census 2030, it will be revisited and reinstituted, because that is going to be the answer for moving forward with disaggregating data, is if we can have granular data for each of the broad racial categories. You can always aggregate up, but having that and then extending it and using that information to design your sample and collect detailed information on the rich, diverse population groups. Thank you.
Thanks for watching. Be sure to like and subscribe for more videos from Brookings.